I'm Dougal Lamont. I'm leader of the Manitoba Liberal Party, MLA for St. Boniface. I'm here with Cindy Lamoureux, MLA for Tyndall Park, and John Gerard, MLA for River Heights, because we've been getting lots of questions about COVID-19, and we want to do our best to answer them properly. There's lots of uncertainty and everything, so if you have a question, feel free to ask. We may not be able to answer it right away, but we'll do our best to answer as accurately as we can. So one of the first questions that we've had is what happens to folks who are dealing with experiencing domestic violence. Look, everybody's in a lockdown, so there are in-person support services, but the challenge is some of those are not open to the public anymore. But we're going to be posting a whole bunch of numbers. Willow Place Crisis has numbers. The provincial crisis line is still going. The Northwind Women's Center is going to be available by phone, online, or groups or 3 less inside. There are still lots of resources. This is incredibly important at this time, because for people, it's a very stressful time already, but also if you're forced to be at home with someone, you're in a very difficult relationship, you need to know that there are places you can go to get out. So we'll post that all underneath. Mm-hmm. And Cindy, I think you had a question from somebody from Tyndall Park.
Yeah, we had quite a few questions actually that have been coming in through email and phone calls in the office. And I was just wondering, can I maybe give a little bit of a preface about what we're doing here?
Absolutely.
Yeah, so the 3 of us have decided that we want to really respect the boundaries and practice social distancing. So we're doing everyday meetings through video chat, Zoom. It's actually a great website, and it's a wonderful way to stay connected with people. And a lot of the questions and concerns that I've been receiving, and I just jotted them down, had to do with childcare, rent payments on both business and living situation levels, flights for Canadians, people coming back, trying to get back into Canada, resources that are being bought in bulk, the domestic violence rates that Dougal already touched on, people who have recently traveled and now they're back in Canada and maybe they're not respecting the social isolation as much as they should be, as well as seniors, everything from home visitations, as well as dispensing drugs and prescription medications, which we'll talk about in a bit. And lastly, just hospital visitation. We know people are in hospitals for reasons beyond COVID-19. There are still babies being born and other illnesses going around, and they're no longer being able to have visitors. And so these are all things that we're hoping to discuss, at least from the Tyndall Park standpoint. But if I do, you want me to answer the first question?
Yeah, that'd be great.
Yeah, so first question.
You don't have to use anyone's real name or anything. So
yeah, we'll be cautious with that. Just a concern with financial aid being put in place, specifically for seniors, because seniors are very vulnerable, and especially with this virus going around. So an answer that we have received from the Prime Minister's office is to provide additional assistance to individuals and families with low and modest incomes with a special top-up payment under goods and services tax. That's the GST credit. And this measure would inject $5.5 billion into the economy. We have also made the Minister of Health informed here at a provincial level about the prescription drugs. And the concern we're having with this is right now you're only allowed to fill prescriptions up to 30 days because of COVID-19. Unfortunately, every time a prescription is filled, people also have to pay a dispensing fee. And so typically we normally do 90 days and 1 dispensing fee. But now with 30 days and 3 dispensing fees, those fees are going up for everyone, not just seniors, but seniors are affected more than everyone else because of the amount of prescription medications they're taking. So I hope that answers the first question.
All right, and briefly, there have been some questions about how HealthLinks and the access centers are working. It's true that initially, when the HealthLinks was designated as the lifeline or the place for people to call when there was concerns about COVID-19. Then there was lots and lots of people calling. The signals were very, very busy, and it was very difficult to get through a week ago. The wait times have gone down from about 2 hours to about half an hour. and the access is improving. But so if you get a busy signal, keep on trying, and hopefully you'll be able to get through. The other thing you can try is that there is an online question that's a screening questionnaire that also will help to answer some comments. The access centers, which have been going for only a little over a week at this point, were also very congested to start with. There were very long wait times. I had a lot of concern because many people were not able to social distance at the access centers, although some people stayed in their cars. Because there's been a lot more access centers set up, that the result is that it's easier now. They're not as congested, but there will shortly be, we expect, an increase in the number of people who will get screened. We don't know exactly what the decision is going to be, but to date, it's only been people who've traveled from outside of Canada or from elsewhere in Canada who have symptoms. It's likely to extend to others in the near future, and we're just waiting for that information.
Now, there was a question, as Cindy mentioned, questions about seniors and medication, because you have seniors who are being asked for refills, or they're expected, basically, there's a limit on the number of refills that they're allowed to have. So there are two things. One is if it's possible to arrange for delivery, and we are going to try to contact the Minister of Health to see if those extra dispensary fees can be waived. Because ultimately, it doesn't make sense for seniors who are vulnerable to COVID-19 to be going out to the pharmacy and standing in line when they don't need to be. And especially that people aren't spending any more money than they need to at this time. So that is something we're going to reach out to the Provincial Minister of Health about, to see if we can we can get that changed.
Mm-hmm. Excellent. Common question that everyone is hearing are airlines, people who are trying to get back into Canada. We know every day more and more airlines are not flying and airports are starting to close down. I know we've received questions about people coming from different countries, and are they in fact going to be able to get back into Canada, especially here in Manitoba, are very Manitobans. And so as of right now, it's really a case-by-case assessment. We are encouraging, if you are currently out of the country, even out of the province, try to get back here as quickly as possible, because it is getting more and more difficult as we go. Don't hesitate to reach out to any of our offices if you're in River Heights, St. Boniface, or in Tyndall Park, and we will assess the case and do whatever it is we can. We're working with the different departments at both the federal and provincial level, hoping to get you back as soon as possible.
Now, John, I think there was a question about small business assistance.
Yes, there has been a lot of concerns from small business people. One of the major ones has been that April 1st, their next rent payment is due, and with the fact that the amount of income for many small businesses has dropped dramatically, many small businesses may actually close very quickly if there's not a solution to this. So we're calling on Brian Pallister to address this situation for business people. And we also, of course, need to address the rental situation for individuals as well.
Because I know we've been getting a lot of emails from people across Manitoba, and even some, I think, from across Canada, looking for some significant relief when it comes to rent, to freezes on evictions. We just put out a press release today calling for the Pallister government to freeze evictions, because we're hearing from people who are concerned that they're going to be evicted at the end of the month because they've been told they have to stay home and they can't work, so they can't make rent. And I know we strongly feel that, look, if the government needs to take these necessary steps to keep people safe and healthy from a pandemic, that the government also needs to step up and make sure that people are able to pay their bills. This is something we are all in it together. The government has said that this is supposed to be, the provincial government has said this is supposed to be an emergency ready budget, and we've made it clear, look, this emergency includes economic emergencies as well. So whether, this is really important for individuals, for landlords, for businesses, that we're looking and waiting for the provincial government to step up with something pretty major. In the meantime, we do think that a ban on evictions, we don't think anybody should be put out on the street at all while this pandemic is going on. It doesn't make sense to be evicting people and putting them on the street, or maybe even making them homeless at a time when we're asking people to stay home. So I think that's it for now, for today. We're going to keep taking questions. We actually have a whole bunch of other questions ready to go, but we are still looking for the answers. But thank you very much. Thank you to John and to Cindy. And we'll pick this up again as soon as we can, probably tomorrow. And we'll see and keep answering your questions as long as you have them.
And keep washing your hands and practicing social distancing.
Yep. What are the rules? What are the rules? Yes, you don't wash your hands for 20 seconds. You don't have to go crazy buying tons of toilet paper. There will be toilet paper. There will be food. There will be clean water. We have to reassure people a little bit too, I think. And this is it, is that if we do this right, if we all pull on this together, it'll make a big difference, and it'll actually prevent people from getting sick at all, which is the goal. So thanks so much, Cindy and John, and we'll see you again soon.